Imagine waking up at like 3 a.m.
Yeah.
The house is completely silent,
Yeah.
but your chest is just pounding so hard you can actually see your shirt moving.
It's terrifying.
It really is. Your heart feels like a fish just flopping around in your ribs. Maybe it's skipping a beat. Maybe it's just racing.
Right.
And for, a terrifying second, you're entirely convinced you're having a heart attack.
Mm-hmm.
Well, up to 54% of postmenopausal women experience this exact, deeply unsettling sensation. And that is exactly why we are here today.
It is.
So welcome to the deep dive. You, our listener, are our third companion, as always. And today we have a very specific, honestly, incredibly common mission.
Yeah, we're taking a huge stack of medical sources, cardiology guidelines, and menopausal research to answer really just one question.
Right. Can menopause cause heart palpitations or like a racing pulse?
It's a phenomenal question, too, because that sensation drives literally countless women into emergency rooms.
Oh, I bet.
Yeah, and doctors' offices. Like, looking at the data from our sources, it accounts for around 16% of all GP visits for women.
Wow. 16%.
Yeah. And it's actually the second most common reason for a cardiology referral.
That's wild.
It is. Women are arriving in an absolute panic, and unfortunately, they're often met with a diagnostic landscape that is, well, pretty murky.
Murky is putting it mildly. So if you're listening to this and you felt that flutter, or, maybe you know someone who has, you are far from alone.
Definitely not alone.
Our goal today is to decode the biology of, why the heart seems to skip a beat during the menopausal transition.
Right.
We want to figure out how to separate a harmless flutter from an actual cardiovascular risk.
Which is crucial.
Exactly. And navigate this massive paradox involving hormone replacement therapy. So, okay, let's unpack this.
Let's do it.
Before we look at the underlying cause, we need to establish the physical reality of what women are actually reporting, because the sources use very vivid language.
They do. They describe it as a flip-flopping sensation.
Right, or like a sudden pounding in the neck or the throat.
Or the really distinct feeling of skipped beats. And, we need to validate that this isn't just an illusion.
It's not just in their heads.
Exactly. It's not just a subjective feeling. The heart rate is physically altering its rhythm.
Yeah.
Studies where they actually monitor women during a hot flash show that the heart rate can suddenly accelerate by like 8 to 16 beats per minute.
Just sitting there.
Just sitting still.
Yep.
That is a massive jump for a resting body.
So to understand why a resting heart suddenly takes off like that, I like to think of the heart as a highly disciplined symphony orchestra.
I love that analogy.
Right, because you have all these different sections, the brass, the strings, the percussion, and they have to play in perfect time to keep the blood pumping effectively.
Mm-hmm.
And estrogen is essentially the master conductor of this whole orchestra.
Mm-hmm.
So when that conductor steps off the podium during the menopausal transition, the brass section, which is like the heart's electrical system, it just loses its rhythm and goes a bit rogue.
It really does. And we can actually trace that rogue behavior down to a very specific cellular level.
Oh, really?
Yeah. Estrogen has a direct mechanical impact on how the heart conducts electrical impulses. Specifically, it regulates these things called T-type calcium channels.
Okay, wait, let's slow down there for a second.
Sure.
Because when you say calcium, most people immediately think of bones, right? Not heartbeats.
That's a fair point, yeah. But in the heart, calcium is the literal trigger for motion.
Oh, okay.
When calcium enters a heart muscle cell through these tiny microscopic gates, the calcium channels, it acts as the spark.
The spark that tells the muscle to squeeze.
Exactly. And estrogen acts as basically a manager for these gates. It suppresses them just enough to keep the heart's pace regular, steady, and disciplined.
Okay, so when a woman enters perimenopause and her estrogen levels start, swinging wildly or dropping off entirely,
that management system disappears. And so the gates start misfiring. Without estrogen keeping them in check, these calcium channels might let in a surge of calcium at the completely wrong millisecond.
and the muscle just gets confused.
Yeah, the heart muscle receives a confused signal and squeezes out of turn. That localized electrical misfire is the actual mechanical reason for the skipped beat.
Or that sudden flip-flop feeling in your chest.
Exactly.
For anyone listening who has felt their heart do backflips, I really hope understanding that mechanical reality strips away some of the panic.
I hope so, too.
Because your heart muscle isn't necessarily failing or dying,
Yeah.
Your calcium channels are just missing their conductor.
Right. It's just a reaction to a changing chemical environment. But a localized misfire in the heart tissue is really only one piece of the puzzle here.
There's more.
Oh, yeah. The body has a master control system that can take these tiny misfires and amplify them into those terrifying pounding episodes women experience.
Ah,
We have to look at the autonomic nervous system.
the ANS.
Mhm.
Okay, so this is the background operating system of the body that handles everything you don't consciously think about.
Mm-hmm. Breathing, digestion, heart rate.
Right. And it operates on a sort of seesaw. On one side, you have the sympathetic nervous system, which is your fight or flight response.
Yes.
And on the other side, you have the parasympathetic nervous system, which is the rest and digest mode.
Perfectly said. And estrogen is a major player in keeping that seesaw perfectly balanced.
Okay, so when estrogen levels plummet,
The parasympathetic activity, that calming, resting side, declines with it.
oh, wow.
Yeah, so the seesaw just slams down on the side of the sympathetic nervous system. The body becomes incredibly sympathetic dominant.
Meaning the fight or flight alarm is just constantly humming in the background,
Exactly. The body becomes hypersensitive to adrenaline.
which I guess perfectly explains why these palpitations are so notorious for happening in the middle of the night.
Right.
Wait, actually, I'm confused. If this is just a mechanical issue with calcium channels missing estrogen, why does it happen so violently at like 3 a.m.?
It's a good question.
Because I'm just lying there doing absolutely nothing. Calcium channels don't care what time it is.
What's fascinating here is how multiple menopausal symptoms collide at night to create basically the perfect storm for a palpitation.
Okay, how so?
First, just simply lying flat in a dark, quiet room removes all the sensory distractions of the daytime.
Oh, sure.
So you are physically positioned to feel subtle rhythms in your chest much more acutely.
You just notice it more.
Yeah. But chemically, nighttime is when we transition between different stages of sleep, from light sleep to deep sleep to REM.
Right.
Every time your brain shifts the sleep stage, it naturally causes a shift in your autonomic tone.
And because that autonomic seesaw is already broken and leaning way too heavily toward fight or flight.
A normal sleep transition suddenly feels like a huge jolt of adrenaline.
Oh, man. That's awful.
And add a night sweat to that. As we mentioned, a hot flash can spike your heart rate by up to 16 beats per minute.
Yeah.
Furthermore, the loss of estrogen structurally changes the airway.
Really?
Yeah, it actually increases the risk of obstructive sleep apnea.
Oh, wow.
So you stop breathing for a few seconds, the brain panics, and it dumps adrenaline into your system to wake you up.
And poor sleep affects, what, up to 60% of menopausal women?
At least. And that chronic sleep deprivation keeps the body in a permanent state of high autonomic alertness.
Just as a brutal feedback loop.
It really is.
Which also, I guess, answers why these palpitations seem so heavily tied to our emotions, like anxiety.
Exactly.
Menopause is a period of massive neurological transition.
Yeah.
Mood swings, new anxieties, depression, these all trigger the brain to release adrenaline.
And because the heart is now unusually sensitive to adrenaline, due to the missing estrogen,
Yeah.
an amount of psychological stress that maybe would have caused a mild reaction 10 years ago now causes the heart to pound intensely.
And then you feel the pounding, which obviously terrifies you,
Right.
which makes you more anxious, which releases more adrenaline.
The emotional stress triggers the physical flutter, and the physical flutter triggers more emotional stress.
Wow. Okay, so we've established why the heart flutters harmlessly due to, calcium gates and adrenaline feedback loops.
Mhm.
But we have to address the elephant in the room here.
Okay.
The sources we're looking at are brutally clear. Menopause is also the exact time when a woman's actual dangerous cardiovascular risk skyrockets.
It is.
So how on earth is a woman supposed to tell the difference between a harmless hormone flutter and actual heart disease?
It's probably the most critical question a patient can ask. First, we rely on what cardiologists call red flag symptoms.
Okay, what are those?
Well, a flip-flop or racing pulse during a hot flash is typically benign, but you require immediate emergency medical attention if those palpitations are accompanied by chest pain, or pain radiating into the back or jaw, fainting, profound shortness of breath, nausea, or if the episode lasts for several minutes rather than just a few seconds.
Got it. So the flutter alone is one thing, but pain, Dizziness or breathlessness means you go to the hospital.
Yes, absolutely.
Yeah.
But we also have to zoom out and look at the wider cardiovascular context
Well,
because the statistics from the American Heart Association are just staggering. Before menopause, about 1 in 9 women have heart disease.
1 in 9.
And after menopause, that leaps to 1 in 3.
Wow.
Women completely lose their statistical cardiovascular advantage over men.
We jump from 1 in 9 to 1 in 3. That is like a terrifying cliff to fall off of.
It is.
And again, this traces back to the loss of estrogen, right? But in a totally different way than the calcium channels we talked about earlier.
Correct.
Estrogen isn't just an electrical conductor. It's a profound structural protector of the blood vessels themselves.
It is. Estrogen promotes the production of a molecule called nitric oxide in the blood vessels.
Nitric oxide.
Yeah, and nitric oxide is basically a chemical relaxer.
Yeah.
It keeps the walls of the arteries pliable and flexible.
So they can expand and dilate easily when blood pumps through them.
Exactly.
Like a fresh young rubber band.
Exactly like that. Estrogen also actively manages cholesterol. It keeps the protective HDL levels high, and it suppresses the harmful LDL levels.
Right.
On top of that, it reduces inflammation within the arterial walls, which is what prevents the buildup of the plaques that actually cause heart attacks.
Okay, so when menopause hits and that estrogen vanishes, the rubber band dries out.
Yeah.
The blood vessels lose that nitric oxide and get stiff. Blood pressure rises because the pipes just can't expand anymore.
Mm-hmm.
The LDL cholesterol starts creeping up, depositing plaque in those stiff arteries. And we see a rapid increase in central body fat around the organs, which is metabolically highly dangerous.
You've got it. All of these overlapping factors, stiff arteries, high blood pressure, rising cholesterol, increased visceral fat. These are the building blocks of metabolic syndrome.
Which is really scary.
And the terrifying part is that arterial stiffness and high cholesterol are completely silent. You don't feel them happening at all.
It sounds almost like a check engine light on a car dashboard.
That's a great way to look at it.
The little light bulb on the dash isn't the actual problem, right?
Yeah.
It's just an annoying light. But it's flashing to warn you that the engine underneath, or in this case your metabolic health, is starting to struggle and needs attention.
If we connect this to the bigger picture, that concept is the entire key to menopausal cardiology.
Really?
Yeah. The palpitations themselves are electrical misfires. They're not a sign of a heart attack, but they arrive precisely at the time when metabolic syndrome and arterial stiffness are secretly setting in.
I see.
So the palpitations act as a vital, accidental alarm bell.
It's the symptom that is finally annoying and terrifying enough to force you into the doctor's office.
Exactly. It prompts women in their late 40s and 50s to finally get a comprehensive lipid panel, to start monitoring their blood pressure daily, and perhaps to get a coronary calcium score screening to look for hidden plaque. It forces a conversation about cardiovascular health at the exact moment that intervention is most crucial.
Right. Before the silent damage becomes permanent.
Exactly.
Okay, so a woman goes to the doctor, they run the lipids, they check the blood pressure, and thankfully the heart is structurally sound, no blockages.
Right.
But she is still dealing with these miserable, sleep-destroying, anxiety-inducing palpitations. How do we actually fix the flutters?
Wow.
Because the obvious logical answer seems to be, if a lack of estrogen is causing the misfires and the stiff arteries, just put the estrogen back.
Right.
Give the woman hormone replacement therapy, or HRT. But the science on HRT in the heart is an absolute maze of contradictions.
It is arguably one of the most complex, debated areas of menopausal medicine in history.
Wow.
Let's look at the immediate symptoms first. HRT is incredibly effective at stopping palpitations and hot flashes.
Good to know.
Yeah, by restoring estrogen to the system, you stabilize the autonomic nervous system, you give the calcium channels their conductor back, and the flutters often vanish entirely.
Here's where it gets really interesting, though.
Yeah.
Because while HRT cures the immediate symptoms, it does not cure the underlying long-term disease risk.
Right.
Our sources bring up a massive 2013 Cochrane review. For anyone not familiar, a Cochrane review is essentially the Supreme Court of medical data.
Yes, it is.
They don't just look at one study. They pool data from dozens of trials to find the absolute truth. And this specific review looked at 19 trials involving over 40,000 women.
And it included historical watershed studies like the HERS trial and the WHI, the Women's Health Initiative.
Right.
We have to pause and understand the historical context here. In the 1980s and 90s, doctors thought estrogen was basically the fountain of youth.
Yeah, they handed out HRT to women in their 60s and 70s under the assumption that it would protect their hearts forever.
Exactly. And the WHI trial in the early 2000s was designed to prove this. But instead, the trial was halted early.
Because it wasn't protecting them, it was actually hurting them.
The medical community was stunned.
I can imagine.
And the 2013 Cochrane Review cemented those findings. It proved definitively that HRT should never be used for the primary or secondary prevention of actual cardiovascular disease.
Let me repeat that for the listener because it feels entirely counterintuitive.
It really does.
Even though losing your natural estrogen causes your heart disease risk to skyrocket, taking synthetic estrogen as HRT does not bring that risk back down.
The pooled data showed that HRT offered zero protective effect against all-cause mortality, cardiovascular death, or non-fatal heart attacks.
Zero.
Zero. In fact, for the overall trial populations, HRT actually increased the risk of stroke.
Oh, wow.
It increased venous thromboembolism, which are blood clots in the veins, and pulmonary embolisms, which are lethal blood clots in the lungs.
So it's like HRT is a highly effective fire extinguisher for a kitchen fire.
Okay.
Yeah. If you have hot flashes and palpitations, you spray the HRT, and it puts that symptom fire out immediately.
Yeah.
But you absolutely cannot spray a fire extinguisher on the walls of your house and expect it to act as a fireproofing system against a future forest fire.
That is a perfect analogy.
It just doesn't prevent heart attacks.
It manages the symptoms of the transition, but it does not reverse the aging of the cardiovascular system.
Right.
Now, there's this one highly critical nuance in the Cochrane data called the timing hypothesis.
The timing hypothesis.
Yes. The researchers found a massive difference in outcomes based entirely on when a woman started taking the hormones.
It's like a window of opportunity.
Exactly. If women started HRT less than 10 years after their menopause began or before age 60, there was actually a slight reduction in mortality and coronary heart disease.
Oh, okay. So it seemed to offer a tiny bit of protection early on.
Right. However, they were still at an increased risk for blood clots.
But what if they started HRT more than 10 years after menopause?
Then the window was completely closed, there were zero heart benefits, and the risk of stroke and blood clots increased significantly.
Wow. Why is that?
The biological theory here is that if you start estrogen early, when the arteries are still relatively healthy and pliable, it might help keep them flexible.
That makes sense.
But if you start it late, after the arteries have already stiffened and arterial plaques have already formed,
Yeah.
flooding the system with estrogen might actually destabilize those existing plaques. A piece of plaque breaks off, travels to the brain or the lungs, and causes a stroke or a clot.
Oh, man. It's a razor-thin balance.
It really is.
So HRT is considered safe and genuinely life-changing for symptom management in healthy women who started early in their menopausal journey.
Yes.
It will stop the palpitations.
Ah,
But a woman cannot rely on a hormone pill to shield her heart long-term.
absolutely not.
So if HRT is just a fire extinguisher for symptoms, what actually fireproofs the house?
Lifestyle is the true, proven shield for the actual heart muscle. While hormones fix the flutters, lifestyle fixes the foundation.
I love that.
And interestingly, a lot of the lifestyle fixes that protect against a future heart attack also directly calm the daily palpitations.
Because the nervous system is already stuck in fight or flight mode, right?
Yes.
So throwing external stimulants into the mix is just pouring gasoline on the fire.
Precisely. Cutting back on caffeine and reducing alcohol intake are critical first steps to calming the autonomic nervous system.
That makes a lot of sense.
Lowering dietary sodium helps bring blood pressure down, which reduces the mechanical stress on those stiffening arteries.
Okay.
Hydration is also paramount, as even mild dehydration forces the heart to beat faster to maintain blood pressure.
But beyond diet, we have to talk about the non-hormonal mind-body therapies mentioned in the sources.
Oh, yes.
Because this is where the science gets truly mind-bending.
It really does.
When you think of treating a physical, measurable symptom, like a racing heart or a hot flash, you do not immediately think of, like, hypnotherapy.
You wouldn't. Honestly, it sounds like pseudoscience.
Right.
But the clinical data is remarkably robust. The sources highlight that mind-body therapy, specifically clinical hypnotherapy and cognitive behavioral therapy, or CBT, they are scientifically proven to reduce hot flashes by up to 80%.
An 80% reduction in physical symptoms
Yes.
without a single medication. That is, How is a conversation or a guided meditation doing the heavy lifting of a hormone?
It goes right back to the autonomic nervous system.
Ah,
Remember that in menopause, the parasympathetic rest and digest system is offline, leaving the sympathetic fight or flight system running wild.
right.
Hypnotherapy and CBT are essentially manual overrides for your nervous system.
Manual override.
Yeah, you are using the prefrontal cortex, the conscious thinking part of your brain, to actively engage the vagus nerve and force the parasympathetic nervous system back online.
So you're consciously ordering the body back into a resting state.
Exactly. By using focused breathing and cognitive reframing, you calm the brain's baseline stress response.
And when the brain stops dumping adrenaline into the bloodstream, the hot flashes drastically reduce.
Yes. And because there is less adrenaline hitting those highly sensitive calcium channels in the heart.
The palpitations calm down too.
Exactly.
Wow. So what does this all mean?
Oh.
We started out looking at a terrifying sensation that sends women to the emergency room. And we've navigated through some incredibly intense biology. Let's wrap up the journey for you. Menopause, absolutely, physically causes heart palpitations. It is a noisy, chaotic collision of missing estrogen, calcium channels losing their conductor, a hyperactive fight-or-flight nervous system, and chronic sleep deprivation.
It's a lot, and while the flutters themselves are usually harmless electrical misfires, they demand your attention.
They really do.
They are your accidental alarm bell warning you that you're entering a phase of life where your invisible risk for real heart disease, stiff arteries, high cholesterol, metabolic syndrome, is quietly skyrocketing.
And hormone replacement therapy can act as a brilliant fire extinguisher to silence the flutters and stop the symptoms, provided you started early.
Right.
But it cannot be used to prevent heart disease. A meticulous lifestyle, managing your cholesterol and keeping your blood pressure in check, is what actually protects the heart.
Which leaves us with a truly fascinating new frontier to consider.
Uh-huh. What's that?
Well, we tend to view the heart as a pure machine, right? A pump that just needs the right chemical oil to function.
Right.
But we now know that the heart and the brain are intimately wired together through the autonomic nervous system.
They aren't separate at all. The emotion dictates the heartbeat, and the heartbeat dictates the emotion.
Exactly. So here's something to ponder long after you finish listening. If conscious therapies like CBT and clinical hypnotherapy can manually override our nervous system,
Yeah.
physically altering our heart's rhythm and reducing hot flashes by 80% just by changing our neural pathways,
Wow.
could learning to master our emotional and psychological stress during our 40s and 50s literally rewire our cardiovascular future?
That is profound.
If the mind has the power to calm the flutter today, could training that mind be the ultimate shield to protect the heart tomorrow?
It makes you realize that the medical world has spent decades looking at the heart in total isolation.
And we just can't do that anymore.
No, we have to look at the whole incredible interconnected system.
Exactly.
Well, that is a perfect place to leave it. Until next time, keep diving deep.